The bladder and urinary sphincter are muscles that work together to store and empty urine throughout the day. For children with neurogenic bladder, the nerves that control the bladder and urinary sphincter, or the muscles themselves, are not working correctly. This can result in muscles that are too strong or too weak, a bladder that is unable to stretch, or a bladder and sphincter that do not work together. Every neurogenic bladder is different. Sometimes, children with neurogenic bladder have a bladder that squeezes out urine when it is not supposed to, or a sphincter that is too weak to hold urine inside the bladder. This leads to urinary incontinence, which is when the child leaks urine when they don't want to. Sometimes, children with neurogenic bladder have a bladder that does not squeeze urine out completely, or a sphincter that is too strong and holds urine in. This leads to leftover urine in the bladder that can collect bacteria and cause urinary tract infections, or crystal formations in the urine that grow into bladder stones. Sometimes, problems in the bladder can cause problems with the kidneys. If the bladder muscle is too strong, or if your child is unable to urinate, pressure can build up in the bladder and back up into the kidneys, causing damage or even kidney failure. Your child may have one or any combination of problems, and the problems may change in unpredictable ways as your child grows older. There is no cure for neurogenic bladder, but with quality lifelong urologic care, we can help your child manage their condition so they have a happy and healthy life. In order to diagnose your child's neurogenic bladder, your physician will use blood tests, urine tests, ultrasounds, and bladder pressure tests. Together, you and your urologist will decide on a treatment plan to protect your child's kidneys, decrease urinary tract infections, and address urine leakage. Initial questions you will need to address are the kidneys at risk? Is your child getting urinary tract infections? Does your child leak urine? Is this bothersome to you or your child? As your child grows older, you will need to address other questions including your child's independence, privacy concerns, social concerns, fertility, and sexual concerns. There are many treatment options for neurogenic bladder. Most children with a neurogenic bladder need to use a catheter to empty urine from the bladder. Other treatments include medications that help relax the bladder or sphincter muscle, or several types of surgery to help the bladder relax and hold urine, or make it easier to use a catheter. Unfortunately, there is no treatment that helps the bladder squeeze better to empty urine. Your child may need any or all of these treatment options as they grow older. At Children's Hospital Colorado, your urologist is here to help. To learn more, please visit our website.